My name is Jolene Neto, and I'm going to be demonstrating the cap change on the central line. So we're going to gather our supplies. We need the cap, alcohol, and a 10 ml syringe with 3 ml of normal saline. I'm going to explain the procedure to the patient. I'm going to verify the patient's name, date of birth, and I'm going to cleanse my hands, apply gloves, I'm gonna make sure that the patient's head of the bed is flat, the patient's laying flat, and there's no pillow underneath the patient to make sure that there's no air able to seep into the central venous line, which would create an air embolism. So I'm gonna explain all of this to my patient, and then I'm gonna make sure that the cap is on, that the clamp is clamped. I'm going to get my 3 ml of water. I'm gonna open the cap without touching it. You're gonna put it onto the syringe. You're gonna prime the cap with normal saline. Once the cap is primed, you're gonna get your alcohol swab and you're gonna clean the port 15 seconds and you're gonna wait for it to dry. Then you're gonna instruct the patient to take a deep breath while you're changing the cap out. So you're gonna let the patient know, okay, I'm gonna change your cap, and you're gonna instruct the patient to hold their breath and move their head to the opposite side as to not breathe down the port. So the patient's gonna take a deep breath, and while the patient is doing that, you're gonna undo the cap quickly and you're gonna put on the new cap. Once you have the new cap on, you're gonna do the push-pause method for 2.5 ml, making sure that the line is unclamped at this time. You're gonna do push-pause for 2.5 ml to make sure that there's patency in the line. And then for the last half ml, you're gonna clamp it and push it to create the negative pressure. And that's the end of the demonstration for the cap change.